Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Summer Knight. She is a physician executive and she's the author of the book, Humanizing Healthcare, Hardwire Humanity into the Future of Health. There's an excerpt from that book on Kevin MD, and that's titled Humane Healthcare Outcomes by Creating Therapeutic Alliances. Summer, welcome to the show.
Thanks, Kevin. Thanks for having me.
So we'll get into your book and article in a little bit, but first off, can you just share your story and journey to where you are today?
Before we even start, just want to thank so many people in your audience, clinicians, physicians, for the amazing work that they're doing, recognizing how this journey on COVID has been such a challenge for so many people. And remembering why so many of us have gotten into healthcare, which is to serve people, and just want to share some gratitude for that. For my background, I wear three main hats. One of them is I'm super passionate about humanizing healthcare. As you can see, I wrote a book about that. I also wear a hat around a non-for-profit called One Humankind, where all the royalties for that book go. And then from a career perspective, as you shared, I started out my career as a firefighter paramedic and then became a doctor from the interactions I had with the emergency room staff and their motivation to me to try and reach for the doctor stars, and practiced medicine, and then became the chief medical officer for the state of Florida. As well as built a number of different healthcare facilities, as well as digital health businesses, and have also been an executive and provider and plan, and now I'm a consultant. So really working on care delivery transformation and things that really humanize healthcare. And this book I indexed on the healthcare consumer and a new definition of that healthcare consumer. But I would also say, as I start out with my first remarks, that maybe even more than the healthcare consumer today, we need to be humanizing healthcare for our fellow clinicians, physicians, and staff people. In the book, I have heard from a number of folks that every person pursuing a career in healthcare should read the book. And I think because although I started out writing a business book, I ended up sharing excerpts of my own life. So I am also a patient with a chronic and complex condition. And then also I'm a CMS generation caregiver. So I have experienced both caring for elderly people in my own home as well as remotely. And then also, unfortunately, and what I talk about in the first chapter of the book is the journey that my youngest son and I had when he was diagnosed with a very aggressive and rare type of cancer. We indexed more on the experience that we had, which unfortunately, at many times created challenges for him around healing because we as a healthcare system really wanted him to conform with the way we think about patients rather than allowing him to be a 13-year-old boy with a tragic diagnosis and allow him to kind of live and grow through that experience. So the first chapter is extremely personal, and I've been told a number of times that it causes people to not want to put it down.
So when you talk about humanizing healthcare, what exactly do you mean by that?
So there's many themes in the book, and we start out by talking about the 3+1 drivers that have been changing healthcare over the past 20 years. So that is consumerism of other industries, not healthcare. It's around the change in technology in other industries that healthcare has been late to pick up, and then as well as the regulatory changes that have occurred. And then the 3+1 came COVID, which really put a spotlight in healthcare, and then created a number of what we call 7 healthcare trends. And so we go in to talk about a number of themes, but the core theme is really around vulnerability. So right now, in our vernacular, we talk about the triple aim, the quadruple aim, the quintuple aim. But when we lay it all out, it really gets to the point of how vulnerable do people feel when they're in the healthcare system, and that can be anywhere from being confused and not being sure about the information that they need to help make decisions. We go into 6 different phases of activation for patients. And what does that mean, right? Because we experience kind of the gamut of individuals that we work with, from those who are completely, come to you prepared, they've got their data, et cetera, to those who we might share a diagnosis, and the next time we see them, if we see them, they might not even have registered that they have this diagnosis. So we go through that. But the core is, how can we create therapeutic alliances? And therapeutic alliances, I've defined in the book, is a bond between the healthcare consumer and their healthcare team, as well as that consumer's natural support network of family, friends, and volunteers. And that therapeutic alliance and bond is based on a mutual sense of caring, a core goal towards health optimization, and trust. And you notice there's a couple of things I added in there that we normally don't talk about too much in healthcare, which is that natural support network and how important that network is, and in focus quite a bit on how leveraging this free army to help us on those healthcare journeys could be extremely compelling, not only from a healing and adherence to plan perspective, but also when you look at the data on the amount of resources that families spend, and employers actually will lose due to presenteeism and absenteeism of employee caregivers, the numbers become astounding and actually are a significant percentage of the entire overall healthcare spend in the US.
Now, talk about what the situation is now. You talk about an ideal of therapeutic alliances in your book. So give us a hypothetical case study of what the situation is now and what we need to do to bring that situation to the ideal therapeutic alliances that you talk about in your book.
I index on and spend some time talking about what does humanizing healthcare mean, and break it up into, we've created a framework. So the framework includes, when we make significant changes, we have to think about the impact to the individual. And so those are the individual would be that healthcare consumer or patient, the clinician, and those relationships that occur. Then also from an organizational perspective, so that's number 2 on the framework. When we're humanizing healthcare, how does that impact strategy? How does it impact the way that we invest going forward? How does that impact people, processes, technology in our operations? And then on the third one is the impact to the ecosystem. And so that could be a community, or that can be nationally. It could be going out there and trying to change rule and regulations, et cetera. So we spend quite a bit of time talking about that humanizing healthcare framework. Then give a pretty in-depth description of what the next gen healthcare delivery system of the future could look like. And obviously, that's more of a futuristic prediction, but one that is steeped in quite a bit of research and experience. And what we named it in chapter 5 is called the Healthfulness Hubs, and really indexed on the consumer's experience through that process, in that they have an ability, depending on where they are around those 6 levels of activation, to have a continuous connectivity experience digitally with their care team. Now, that doesn't mean that they're constantly talking to their doctor, because we go into that more specifically as well. But so continuously connected digitally. Then as the need arises for different types of care, we surface different virtual health use cases. And those could run the gamut from everything from more of an AI-based urgent care experience. And many people learned about that and experienced that when we first learned about COVID, all the way to hospital and home, where we've seen we've gotten more approval to do more types of experiences in hospital and home, and then of course in person as people need to, but with more of a service to the individual healthcare consumer, thinking about them as a client at the top of the pyramid. So that would be a combination around home visits, mobile clinics, and then moving into retail and potentially center of excellence for specific, more higher need care where they need to go somewhere where there are specialists. And then we also talk about in that new care model that there's a very different workflow for the care team. So there's space to really allow clinicians who feel that that's an important part for their work-life balance to be able to, number one, have time for compassion with the patients that they're dealing with. We just don't, in an RVU fee-for-service situation, it's very challenging to do that, but also to reconfigure the team in a way that that the individuals who are seeking care may have more interactions with more of the support team, like a guide, a care coordinator, care manager, rather than putting all of that emotional energy on the physician. And that then allows the physician to move more upstream by being able to allow them to deal with more chronic and complex conditions, but also by using AI and machine learning to, first of all, take off the plate task-oriented items that could really move into the background that are really frustrating for clinicians. And then also using more cognitive support for decision making and just moving through the vast amount of data, because there's just so much data coming forward for clinicians that it's really difficult to be able to, or I should say impossible for each of us to be able to keep up with the massive amount of information that's out there.
So I think certainly your model sounds appealing, but as you know, with our current healthcare system and our current payment system, there's a lot of inertia. So what actionable things need to happen in order to get from where we are now to the ideal model that you described?
I would break it up into two pathways. There's incremental change that organizations can take. And then there is pretty transformational change. And those organizations that are doing the transformational change, we see that it's coming in as disruptors. So, so different from our traditional institutions that we've been used to. We've been warning for many years that, hey, these disruptors are coming. Well, they're here and participating. For more of the traditional organizations, though, we are seeing a pretty significant lean in openness to how can we transform the care that we're delivering, because we have more demand than supply, and we need to create efficiencies. And because of the COVID situation, fee-for-service was really a challenging environment for many providers. And so moving into a value-based relationship, the value of that to the providers has become more obvious from that experience. And of course, there's still so many unknowns, but we really are moving in that direction as a nation. And so what we're seeing some organizations doing is to stand up kind of a dual care delivery system, if you will. Now that's really expensive to do and challenging. And the tipping point that we're seeing is when organizations are around 40 in the low 40% of value-based care, that they are starting to make the plunge to leaning into that alternative care delivery system. I'm also seeing, since I wrote the book, have really been having a number of conversations with health plans and digital health organizations, as well as some providers who are just saying, I'd love to do this, but I can't afford it, which is a very real fact, right? We're talking about building a a new infrastructure on digital rather than all the bricks and mortar that we've been doing up until this point. And so, so to do that requires a significant capital infusion and expertise that most clinical providers don't have. And so, seeing real interest in creating a demonstration project that would be open door, all comers see, where different, where it's cloud based, it's available for different digital health organizations to be part of this purpose-driven platform in order to really show the rest of the community what we can do with a digital leaning first approach. And so that's very exciting, and excited to be part of that evolution. We were playing with some names for that, how we have healthcare. We're talking about, maybe it's more purpose-driven care plus health, ecosystem for people to be part of.
We're talking to Summer Knight. She is a physician executive, and she's the author of the book, Humanizing Healthcare, Hardwire Humanity into the Future of Health. Summer, so from the perspective of an individual primary care clinician like myself, what do we have to look forward to realistically in the next, say, 3 to 5 years?
So I think in the next 3 to 5 years, we're going to continue to see the incremental changes happening in primary care. However, because of disruptors and because of projects similar to what I just shared, we are going to see new care delivery systems coming out. And it's not going to be a one size fits all. I think you can read my book and think that might be interested for a certain subset of the population, but maybe not everybody. And so we will continue to see these care delivery models roll out. And I think, we talk a lot about what consumers are they appropriate for, but I don't think we spend enough time talking about what types of clinicians are going to be attracted to these new models. And I think that's something that we need to really be aware of. And so I would just say, as your audience is thinking about their careers and what they're interested in doing, is to begin to think about, are there other models that you'd like to practice in? Is there something that might light you up? And then begin to look for those models because they are either out there or evolving and looking for clinicians to participate.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
I think I go back to the fact that, we all chose healthcare to care for people and to serve people. And it's such a noble career. And we had to work hard to get there, even when we chose it. So many people tried to choose it and they didn't make it. And, in the tough times of COVID, I guess just remembering that every single day you are a hero and that people are burnt out. People are retiring early. And, I guess I would just leave it with, big group hug, and just, it's tough. And we have to support each other. Our situation is I think demoralizing for so many people and sad. And just want to send lots of energy and care and compassion to everyone on the front lines.
Summer, thank you so much for sharing your time and insight. And thanks again for being on the show.
Kevin, thanks for having me. It was such a pleasure.